Now we'll look at another category of disease conditions of the bone, and these are they are called what? Metabolic bone diseases. All right, metabolic bone diseases. So these ones, you are basically having weak bones. The bones are prone to fracture simply because what? One or two things are not balanced in the body. You understand that kind of thing now? So let's quickly look at them. So metabolic bone diseases is not one disease, okay? It's a group of disease conditions, and generally they have to do with you having weak bones, okay? So okay, so there are a set of conditions that affect the bone strength, density, and growth. So you are now having weak bones. So the bones constantly, they remodel. Bone is made up, bone is destroyed, okay? So if any of those processes is not balanced, you're now having weak bones, So key minerals that usually lead to help that bones are strong include calcium, phosphorus, vitamin D. So there are deficiencies too, can basically lead to you having weak bones. So types of the metabolic bone disease, I'll just list and pass because all of them will still come back and discuss about them, but you can pause and observe the causes, the key features, and also the common risk. We have osteoporosis, we have osteomalacia and rickets, we have hyperparathyroidism. So the parathyroid hormone is actually excess. We have Paget's disease of the bone. Then we also have the renal osteodystrophy. All right. So symptoms is what? Bone pains or tenderness, frequent fractures, skeletal deformities, delayed growth in children, loss of height, So you diagnose it from all those bone mineral density tests, also blood tests, X-rays, and also CT scans. How about the treatment? The lifestyle modification is more of like they identify what is deficient in your body, and probably you need to now start taking food that contain it. Do you understand? Weight bearing exercise. They give you drugs, for the different type, or the treatment depends on the type that comes in. So when we're talking about the individual ones, we'll get to talk about the treatment of each of them.